If you're an acupuncturist treating pain, inflammation, or chronic internal disease, and your results aren't holding, this training is for you. Today, I'm going to show you how to diagnose and treat electrical deficiencies at the neural level using electric bracketing. My name is Dr. Jeremy Steiner. For over 20 years, I've helped acupuncturists improve clinical outcomes using modern electric medicine techniques. At the Electroacupuncture Institute, our mission is to equip practitioners with science-based tools that actually work in the clinic. Not theory, not guesswork, but reproducible results. Stick around to the end, grab the free resource, and if you find this training valuable, please like, follow, and share the video.
So let's sum up the pain and inflammation brackets. They should be 20 minutes. They should be 2 needles with a higher voltage device, 4 to 8 needles with a lower voltage device. You have the 2 different setups, carrier and treatment for lower voltage device, or frequency harmonics for higher voltage device. Lower voltage device, you're going to do huatojajis. Higher voltage device, you're going to do dew channel points. And then this is the diagnostic thing that you use. Patient comes in, ask them to touch the pain. Wherever they put their hand, that's diagnostic of that neural level being deficient. Now let's move into internal medicine land. Starting with cardiovascular and respiratory, the bracket technique is the same, and it's still 20 minutes, and it can be 30 minutes, but don't go over 30 minutes. It's still in lateral recumbent, never in prone. We have Rendu organ charge up. That's that treatment. It's super simple. You can put pads and leave it overnight, or you can needle 2 points to do a Rendu organ charge if you want. The electricity is going to go up the dew channel and exit at the diseased organ, which is a deficiency of electricity, which is also a deficiency of electricity on the neural level. Once that's charged up, if you're using a higher voltage device, maybe 5-10 minutes, that electricity keeps traveling up the dew channel until it exits at another organ. If there's no more organs that are deficient, it will travel up over the head and start flowing down the front of the Ren channel. Now we have organs, which I'm not going to go over everything on these slides. You could do that on your own if it interests you. But the most important thing about these slides is it's just giving you a hint. It's telling you the level, that neural level. So for example, we're talking about the lungs. When the lungs are deficient in electricity, the neural levels of T3 and T4 are also deficient in electricity, which means by making a bracket around T3 or T4, we can send electricity on those nerves into the lungs. Now, the blood electric, is that getting electricity into the lungs? Probably, right? Awful lot of blood flows through the lungs. Diaphragm, you can treat, I think about this as hiccups, really. If there's hiccups, the diaphragm muscle is deficient, and so I choose T7, T8. But you can also treat it from the phrenic nerve, C4, C5. Heart, #1 killer in the United States, heart disease. And we're looking at T5 and T6 being deficient. Now, the heart organ is also innervated by the vagus nerve. So you can send Ichi directly to the heart organ on the vagus nerve, stomach 9. It will also respond when you increase parasympathetic tone in the vagus nerve. Do you all know how to do that from what I taught you this week? How do you increase parasympathetic tone in any nerve? Just treat it for longer than 20 minutes. So a couple more points about the vagus nerve. Right side directly innervates the stomach organ and the heart directly. Left side directly also, but it's like an 80-20 sort of thing. So by putting electricity into the right vagus nerve here, you can get the stomach to go more into parasympathetic tone. What's more parasympathetic tone? It starts increasing acid production, which on the flip side starts producing sodium bicarb into the venous system of the stomach. Very cool. Left side has been researched for turning off. It directly innervates spleen organ and adrenals. It turns off inflammatory factors for autoimmune disorders like rheumatoid arthritis. So you can completely get rid of rheumatoid arthritis by treating left side vagus nerve. And we have it better than the researchers because when they stopped stimming the left side vagus nerve, 40 days later, the rheumatoid arthritis came back. But we can fix it by doing the treatments I'm teaching you. Get rid of all the deficiencies in the other terrains.
I've included a free download that walks you through how to balance the autonomic nervous system using effective needle placement, bracketing, and frequency selection. Grab it below and use it directly in your clinic.
Right? And like the immune system in the blood, for example. Cool. Pericardium's an organ. And then we're into the endocrine system. Thyroid, a super important organ. I think it's like 40% of the thyroid function is for total body charge. So if you use an acugraph to measure channels and every single thing is deficient, it's either hypothyroid or gallbladder channel issue. But it's connected to the T1 neural level. Thyroid responds to sympathetic versus parasympathetic. So it's only secreting thyroid hormone and producing it with good parasympathetic, which is why when you make a bracket for it, you treat for more than 20 minutes, it's turning, that's a sympathetic nerve at T1 feeding the thyroid. You turn off that sympathetic nerve by doing 20 minutes or more. And also you're charging up the thyroid tissue directly on that neural level. If you do this treatment and the patient has the raw building blocks of thyroid hormone, then they walk out of your office, if they have hypothyroid, with more thyroid hormone than before, right? But remember, iodine, super important nutrient. They removed it from our diet. They replaced iodine in salt with similar things that block iodine. Fluoride, for example, is on the chemical chart, one position different. And so thyroid hormone is supposed to be 4 molecules, I think, of iodine or iodide, not sure. But if there's fluoride, like the patient's been drinking tap water, that fluoride will bump, it's got a higher affinity for the molecule, it will bump the iodine off the thyroid hormone and you will create fake thyroid hormone. And fake thyroid hormone shows up normal on blood tests, which is why, what is my second least favorite practitioner in the world?
Endocrinologist.
You got it, endocrinologist. So I said 40% of the thyroid function is, what did I say? Total body voltage. 60% of thyroid function is temperature. And I may have switched those two percentages up. It's been a long time since I taught this. But it doesn't really matter. But temperature is super important. Just a 1/4 degree difference in body temperature can make more than 100 enzymatic processes slower or faster. So thyroid's super important. And you're like, well, how do you diagnose thyroid? Well, your patient comes in, they're like, I'm on levothyroxine, I'm on thyroid medications, I've already been diagnosed with hypothyroid. Bam, instant diagnosis, thyroid organ, you already know T1. How do you remember that? Thyroid's super important, number 1 important, T1. You can also get electricity into the thyroid on a branch of the vagus nerve in the front, which is called the superior laryngeal nerve. You find stomach 9, which is halfway between Adam's apple and medial border of SCM. There's a space there. You feel for the pulsing carotid artery, and that's your target. Oh my God, did he just tell me to target the carotid artery with a needle? Yes. I didn't say stick the needle in there, into the carotid artery. The carotid artery, the jugular vein, and the vagus nerve are all in this highly conductive sheath. You just need to bring your needle close to that, but feel for the pulsing, go perpendicular. If you're scared, come see me in my May mastermind and we'll practice it. Now, superior laryngeal nerve, you find stomach 9 proper, go superior quartersun and medial quartersun. That's more of a shallow insertion. That's directly a vagus branch that's going to the thyroid organ. Also, there's a branch of the vagus going, actually the vagus nerve innervates the whole concha floor of the ear. And then closer to the ear canal, the more closer to the surface the vagus nerve comes. So the ear is a pretty cool place to access vagal stimulation as well. Yes, we can treat pancreas issues. How do I know if my patient has a pancreas issue? I don't know. Do they have diabetes? Super common diseases, which for us are symptoms that are leading the way, pointing the way to what terrain is deficient. In this case, the pancreas would be a tissue that's deficient in many diabetic patients. And that automatically leads you to know that the T8 and T9 neural levels are probably deficient as well. There's your diagnosis. And then how do you treat a T8, T9 neural level deficiency? Super difficult question, right? Another way of asking this is, who's buried in Grant's tomb? Spinal circuitry is awesome for diagnosis, but it's also awesome for treatment because the second most electrically conductive tissue of the body is the outer covering of spinal nerves. Adrenals. Now, adrenal, big bold letters, amazing treatment. Maybe in the 1920s, the adrenal treatment wouldn't work for most patients. But now in 2025, most of our patients have adrenal insufficiency. We had a patient, and I said, how do you categorize this patient? You all said level 3. Why did you say category 3, severe category? Probably, I'm guessing, because she had this problem for a year. She's been treating it with PT or what else, and it hasn't been going away, right? But if a patient has any of those 4 dental issues, and there's 4 wisdom teeth, and 280 million Americans have had 1 or more wisdom teeth taken out, 90% of wisdom tooth extractions fail and turn into silent infections called cavitations. Why are they silent? Because the pathogen eats away at the trigeminal nerve and they don't feel anything anymore. High percentage of patients. So I said, do you have any wisdom tooth extractions? She's like, yes. Bam, instant category 3 confirmation. Remember, the 4 fire channels flow through the wisdom teeth, and I taught you the autonomic nervous system balance treatment. Triple energizer 5, PC6. Remember, triple energizer is related to sympathetic system. Pericardium is related to parasympathetic system.
Thanks for watching. If this training was helpful, make sure to like and subscribe for more clinical resources from the Electroacupuncture Institute. I'll see you in the next training.